So people, now let us look at this question. Mention the nerve supply and action of external intercostal muscle. Okay. So of some muscle, they are asking you the action, external intercostal muscle. So when was this question asked? This question was asked in anatomy final year November 2023 paper. So this is an important question. So what is costal? Costal means rib. So here you have rib, rib, rib. So between these ribs you have intercostal, that is intercostal space, right? Intercostal. So intercostal means between these ribs. Now what is external intercostal? External means outside the whatever muscle is there, that is external intercostal. Similarly, you have internal intercostal, then you have transverse intercostal and all that, right? So many muscles are there. But in this, what are we focusing? We're focusing on the external intercostal muscle. So where is it originating and inserting? From one rib above to the rib below, it will origin to insert. Okay, so that if you want, you can mention some things you can mention if you want. Okay, then let's move on. They've asked basically the nerve supply. How will the nerve be? Come on, people, you will very easily say the nerve supply is nothing but the intercostal nerve only. So intercostal muscle, the nerve supply is intercostal nerve. So from where is this intercostal nerve coming? From behind. That is in the spinal. From spinal cord, they are coming like this. Correct? The intercostal nerves. So this, what is the origin? T1 to T11 spinal nerve. That's all. T1 to T11 spinal nerve. If you want more details, you can say from the ventral primary rami of the thoracic 1 to thoracic 11 spinal nerves. After the something, you can remember that if you want. Okay. Just remember T1 to T11 spinal nerves, primary ventral primary rami. Okay. If you want, you can draw this diagram and all. But I have not learned that much. Okay. Then coming to action. Now we have come to the second part of the question. Action of this muscle. What do you think the action of this muscle is? Mainly inspiration. So what type of inspiration? Any inspiration, quiet inspiration, deep inspiration, forced inspiration, any inspiration, you can use this muscle. Okay, so basically it is going to help you ribs. You know what will happen to the ribs? The ribs will go up. So what will happen when the ribs go up? This diameter of the thoracic cage will increase. Correct? So this is called as the what movement? Do you know the name of this movement, people? Bucket handle. Very good. Bucket handle movement. Elevate the ribs is what? Bucket handle movement of the ribs because of this external intercostal muscle. So it is going to help in inspiration. One more point that they have written here is it prevents the intercostal space from being drawn in. Okay, during inspiration. It just keeps this intercostal space, all that structure it is maintaining. So here you can see that bucket handle movement. You make the bucket handle go up. No, what will happen? Like that, the rib will go up. The time the transverse diameter of your thoracic cage will increase. So this is the clinical anatomy. So at the end of this question, you write one line. You write clinical anatomy. Bucket handle movement of the ribs because of this external intercostal muscle will make the transverse diameter of the thoracic cage more. Hence, we will be able to inspire. Okay, that's all. Bucket handle movement I have written here. So that is the clinical importance. So you're done with this question. That is the nerve supply and action of external intercostal muscle. Okay.